Bon après-midi tout le monde. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Good afternoon everyone and welcome to this afternoon's briefing on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, Ministre de la Santé. Dr. Russell.
Bonjour à toutes et à tous. Good afternoon, everyone. Le Nouveau-Brunswick a connu des succès particulièrement notables dans sa lutte contre la pandémie de COVID-19 et nous pouvons en être fiers. Il y a eu moins de cas de COVID-19 dans notre province qu'ailleurs en Amérique du Nord et bien moins de décès. En cours de route, nous avons réussi à mettre un terme à une série d'éclosions locales et plus récemment à renverser la montée en flèche du nombre d'infections survenues après le temps des fêtes. New Brunswick has enjoyed some notable successes in our journey through the COVID-19 pandemic, in which we can all take great pride. We have seen fewer cases of COVID-19 than many other jurisdictions in North America and far fewer deaths. Along the way, we have turned back a series of local outbreaks, most recently the surge in infections we saw after the Christmas holidays. We have not waited to be overwhelmed by a crisis. We rode out to confront the virus, slowing its spread with bold, decisive, and innovative measures. Protecting New Brunswickers from further outbreaks will require more of these bold actions, and we are prepared to take them. Vaccines are now available that provide protection against the COVID-19 virus. And we have moved as quickly as we could with our campaign rollout, given the uncertain availability of vaccines. But it has not been fast enough. We must get the COVID-19 vaccine into the arms of more New Brunswickers, and we have to do it quickly. Avec l'arrivée de nouveaux variants de la COVID-19 ayant un degré de transmissibilité plus élevé, il est d'une importance cruciale que nous élargissions la portée de notre campagne d'immunisation. Il faudra qu'on continue avec la traduction. We're going to have to continue without translation. Je m'excuse, our apologies. Avec l'arrivée de nouveaux variants de la COVID-19 ayant un degré de transmissibilité plus élevé, il est d'une importance cruciale que nous élargissions la portée de notre campagne d'immunisation. Nous devons nous assurer que tous les citoyens du Nouveau-Brunswick qui sont le plus à risque reçoivent une certaine protection contre le virus. So with the new variants of COVID-19 being more transmissible, it is really important that we make sure that we have our vaccine campaign underway. We really have to make sure that our citizens in New Brunswick that are the most at risk receive protection against the virus. So we must broaden the scope of our vaccine campaign, and we need to ensure that we do protect those most vulnerable. To vaccinate more people, we may have to delay the second dose for some who are at lower risk. This approach carries some unknowns, but it is the one that is being increasingly used as an acceptable and manageable option. Our failure to act, in fact, would be the greatest risk to New Brunswickers. Minister Shephard will speak to the details of our revised vaccine strategy, and I would like to explain why we are taking these actions and how they will benefit those at greatest risk from COVID-19. We find ourselves in the eye of a perfect storm that could lead to new outbreaks. New variants of COVID-19 that move more easily and spread more readily have been detected in every part of Canada, including New Brunswick. Nous nous retrouvons devant un concours de circonstances parfait qui pourrait causer de nouvelles éclosions. De nouveaux variants de la COVID-19 qui se déplacent plus rapidement et se propagent plus facilement ont été décelés dans toutes les régions du Canada, y compris le Nouveau-Brunswick. In time, these more aggressive strains will become the predominant form of the virus. At the same time, we are seeing an increasing level of pandemic fatigue, which makes it more challenging to ensure adherence to public health advice and guidelines. We have seen what happens when these new variants strike. Last week's outbreak in Newfoundland led to more than 200 infections in less than a week. Concurrently, we have begun vaccinating our citizens. We knew supplies would be limited at the start, and so we have concentrated on vaccinating those at highest risk of either severe disease or exposure: frontline healthcare and long-term care workers, long-term care residents, First Nations adults, and those over the age of 85. During this phase, we have strived to get 2 doses into anyone who received the vaccine. Nous constatons cependant qu'une seule dose est efficace et l'expérience acquise avec d'autres vaccins nous permet de croire qu'une seule dose peut aider les personnes qui ont besoin de protection pour une période de temps raisonnable. La première dose des vaccins à ARNM, Moderna et Pfizer-BioNTech, offre une protection de plus de 90% 14 jours après la vaccination. Il est recommandé d'administrer une deuxième dose dans les 28 jours qui suivent la première. Certaines administrations canadiennes attendent présentement 42 jours ou plus avant d'administrer la deuxième dose. But we are learning that a single dose is effective, and we expect this can help those in need of protection for a period of time based on experience with other vaccines. The first dose from the mRNA vaccines, Moderna and Pfizer-BioNTech, offers more than 90% protection starting 14 days after the shot. The recommended practice is to administer the second dose within 28 days. Some Canadian jurisdictions are now waiting for 42 days or more. But I should note that some countries are waiting up to 90 days between doses, including the United Kingdom, which has a significant amount of its people now vaccinated. Our goal will be to administer the second dose as soon as we can, but certainly within 90 days. This is keeping with our goal to maximize the number of vulnerable people receiving at least 1 dose of the vaccine. We will delay the second dose for those who are at lower risk of severe outcomes while giving the 2-dose schedule on time for the most vulnerable. By offering some protection to those who may become seriously ill, we will reduce potential hospitalizations and keep our healthcare workers and facilities from being overwhelmed. Nous savons que le virus est particulièrement dangereux pour les personnes de plus de 70 ans. Ces personnes seront prioritaires au cours de la prochaine phase d'immunisation qui débutera en avril. Nous placerons en priorité les plus jeunes adultes qui ont des problèmes de santé complexes pour éviter qu'ils se retrouvent à l'hôpital en raison de complications graves attribuables au virus. We know that the virus presents a danger to those over the age of 70. They will be a priority group in the next phase, which will begin in April. We will prioritize younger adults with complex medical conditions to help keep them from ending up in the hospital with serious complications from the virus. We will also protect those whose residence or work make them vulnerable: residents and staff of communal settings, additional health professionals with patient contact, police officers and firefighters, home care support workers, those who cross borders for work, and volunteers and designated support persons within the long-term care facilities. These groups may not receive the second dose as quickly, but this approach will provide a high level of protection to a larger number of people. It remains our intention to provide every person with their second dose. And I remain hopeful that by this summer, there will be sufficient vaccines available to meet the needs of the overall population. This is not a perfect approach, but action is required. Through this effort, we will be giving more New Brunswickers a chance to fend off this virus, limiting future outbreaks, and protecting those in greatest need of protection. Ainsi, nous permettrons à davantage de citoyens du Nouveau-Brunswick de combattre ce virus, limitant du même coup les éclosions futures et protégeant ceux qui en ont le plus besoin. Aujourd'hui, Santé publique annonce qu'il y a 4 nouveaux cas de COVID-19 au Nouveau-Brunswick. Ils sont tous dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a présentement 111 cas actifs de COVID-19 dans la province. 5 personnes sont présentement hospitalisées en raison de COVID-19, dont une aux soins intensifs. Today, Public Health is reporting 4 new confirmed cases of COVID-19 in New Brunswick. All of these cases are in Zone 4, which is the Edmundston, Grand Falls, and St. Quentin region. There are now 111 active cases of COVID-19 in our province, 5 individuals who are currently in hospital, including one who requires intensive care. Please keep these New Brunswickers and every other person whose life has been touched by this virus in your thoughts and prayers as you go about your day. La diminution du nombre de cas est encourageante, surtout dans la zone 4. Je tiens à remercier les gens de la région du Madawaska pour tous les efforts qu'ils ont déployés et qu'ils continuent de déployer afin de limiter la propagation de la COVID-19. Vos efforts acharnés ont porté fruit. Santé publique a recommandé au cabinet que la zone 4 retourne à la phase d'alerte orange. Le fait que tout le Nouveau-Brunswick se retrouve à nouveau à la phase d'alerte orange constitue une réalisation de taille. Cependant, nous devons continuer à faire tout notre possible pour poursuivre sur cette lancée positive. I want to offer my thanks to the people of Madawaska for all that they have done to continue to do to spread the limit of COVID-19. And my sincere thanks to our public health nursing staff, EMP, A&B, the prompt teams, our regional health authority partners, the leadership in those areas. It's been such a concerted effort between Vitalité and also Horizon. We are very grateful for that collaboration. And I know that that is part of our success, and it has been the formula for our success up until now. So thank you very much. Your hard work has definitely paid off. And I also want to thank New Brunswickers for the sacrifices they're making right now, again, to bring us to this point. Public Health has recommended to Cabinet that Zone 4 return to the orange alert level. And I do want to show you a slide, so you're going to be able to see this on your screen. And what this depicts is that this is Zone 4 since the beginning of the year, and the orange line represents the number of cases, but that orange line does not include those cases in long-term care facilities. The blue line does factor in those cases, including the long-term care facilities, but what you can see is that when the lockdown was implemented and we moved to the red phase, we had moved to the red phase a few days prior to that, it demonstrates that public health measures do prove to be effective when people follow them. So that is really good information, really good data, and I'm pleased to be able to show that to you. I think it just reinforces the message that we are really working hard, and when we put our heads together and we put our minds together and we roll up our sleeves and do this work together, that we do succeed. Having all of New Brunswick once again at the orange level is a significant achievement. But we must continue to do all we can to maintain this positive momentum. And I know that with the talk of variants and the vaccines not rolling out as quickly as we want, I think that has resulted in some people feeling quite deflated. But right now, I think we can be positive about the success that we've achieved thus far. So please continue to wear a well-made and well-fitting mask when you're out in public. Please maintain 2 meters of physical distance from others you meet. And please stay at home when you don't feel well. Please get tested when you have symptoms, no matter how trivial they may seem. All of these actions will reduce infections, slow the spread of the disease, and save lives. And they will help us buy the time we need to get our population vaccinated so that we can keep New Brunswick on this positive track. Thank you so much. Bonne journée.
Merci, Dr. Russell. Au cause de problèmes techniques, on va prendre une petite pause de 10 à 15 minutes. Merci pour votre patience. Je m'excuse, tout le monde. We're going to take a 10-minute break due to a technical difficulty, so we should resume in about 10 minutes. I apologize for this delay. Merci tout le monde pour votre patience, excusez-moi. Thank you everybody for your patience. Minister Shephard.
Good afternoon, bonjour. Today, Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted a recommendation from Public Health to move Zone 4, the Edmundston region, to the orange level of recovery. This change will go into effect at midnight tonight. I know the last several weeks have been very difficult for those living in Zone 4. I want to thank everyone in this region for following the rules and doing their part to move from lockdown to the red level and now to the orange level so quickly. I'm pleased that tomorrow the entire province will be orange, which means many businesses can open with their operational plans in place, and we can all spend time with our steady 10 contacts. Since COVID first appeared in New Brunswick last March, we have monitored the situation closely and responded quickly based on the best information available to us. As the pandemic has evolved, so has our response. We have listened closely to the advice of Public Health, and we have looked to other jurisdictions to find best practices that are working here in Canada and around the world. Over the past 11 months, our approach has been nimble and adaptable, but one thing has always remained consistent. Our goal has always been to protect New Brunswickers, especially our most vulnerable residents. This was our objective when we began our vaccine rollout in December. In the first phase of the vaccine plan, we are focused on vaccinating priority groups, including residents and staff in long-term care facilities, healthcare workers with direct patient contact, adults in First Nation communities, and New Brunswickers 85 and over. These groups continue to be our top priority. We remain focused on vaccinating staff and residents in long-term care homes as quickly as possible. This will help prevent future outbreaks in these facilities and will protect those who are facing the greatest risk from COVID-19. I'm pleased to announce the First Nations health directors and community health nurses have recently been engaged to provide the vaccine to community members through community clinics with the support of Public Health. We expect the first such clinic to take place during the first week of March, at the Madawaska-Maliseet First Nation, which is located in Zone 4. We will continue to set up clinics in other First Nation communities in the weeks ahead. Because of the limited supply of vaccines and unexpected changes to delivery schedules, we expect it will take until the end of March to offer the vaccine to everyone in our first priority group, including healthcare workers and individuals 85 and over. Once we have vaccinated all long-term care residents and staff, we will provide clinics for healthcare workers. We will also be sharing details about how people who are 85 and older can register to be vaccinated in the coming weeks. We will provide clinics and regions across the province to ensure the vaccination is accessible to everyone in this group. Now we can look ahead to April and May, when we can expect to be able to start vaccinating new groups of people. In April, we plan to offer the first dose of the vaccine to everyone over 70, beginning with those aged 80 to 84. In April and May, we will also offer the first dose to residents and staff of communal settings, healthcare professionals providing direct patient care like pharmacists and dentists, first responders including firefighters and police officers, home support workers for seniors, people with select complex medical conditions, and long-term care volunteers, designated support persons, individuals 40 and over with 3 or more chronic conditions, and truckers, rotational workers, and regular cross-border work commuters. By June, we expect to be able to provide the second dose of vaccine to people over 70 who received their first dose in April or May. Based on the amount of vaccine made available to us by the federal government, we also expect to provide a second dose to other groups who received their first dose in April or May. In June, we will begin to vaccinate additional groups, including all individuals who have 2 or more chronic health conditions, healthcare workers with indirect patient contact, school staff, and high school and post-secondary students aged 16 to 24. We expect vaccine shipments to increase significantly over the summer, which will allow us to offer the vaccine to all New Brunswickers who have not yet received it between July and September. We also anticipate that over the course of the summer, we will be able to provide a second dose to anyone who has not yet received it. As Dr. Russell explained, even a single dose of the Pfizer-BioNTech or Moderna vaccine provides more than 90% protection 14 days after receiving the shot. Delaying the second dose is a strategy that has been recommended by public health to ensure as many people as possible are protected. We are confident this plan is the best way to ensure vulnerable residents are protected in a timely manner while also addressing delays in vaccine shipments. We remain committed to ensuring all New Brunswickers who want the vaccine will be able to access it as quickly as possible. If more doses than expected do become available, we fully intend to readjust the plan again. I know there are many groups and people who want to be at the front of the line, and I understand that. The pandemic has taken over our lives for a year, and we all just want it to be over. This vaccination strategy will allow us to act quickly to protect the most vulnerable, so we can live life as normally as possible while we wait for the additional vaccine shipments. Our province continues to be a leader in addressing COVID-19. We have had setbacks along the way, but we've learned quickly and adapted new guidelines to slow the spread of the virus. As our vaccine rollout continues, we can be proud of the progress we have made. Despite supply interruptions and the presence of the UK variant, we have held clinics across the province since we first received vaccine doses in December. As of Tuesday, 21,182 New Brunswickers have received their first dose of the vaccine, and 7,505 are fully vaccinated. We will continue to expand on that progress exponentially as we receive larger numbers of vaccine in the weeks and months ahead. If you are a part of one of the priority groups I've mentioned today, please be advised that we will have more information very soon about how you can register to be vaccinated. Members of the public who do not fall under any of the priority groups will also receive information prior to July about what they need to do to register. There is no need to contact 811 or a medical provider right now to inquire about being vaccinated. We will provide everything you need to know once your turn arrives. Please continue to be patient. Vaccines are coming. For now, keep up the great work. Continue to wear a mask in public, maintain a safe physical distance, and get tested if you are experiencing any symptoms. Stay safe, and remember, we are all in this together. Thank you. Merci.
Bonjour à toutes et à tous. Je vais répéter tout ce que j'avais dit déjà. I'm going to reread my speech. We had a technical difficulty, so I will begin again. Bonjour à toutes et à tous. Good afternoon, everyone. Le Nouveau-Brunswick a connu des succès particulièrement notables dans sa lutte contre la pandémie de COVID-19 et nous pouvons en être fiers. Il y a eu moins de cas de COVID-19 dans la province qu'ailleurs qu'en Amérique du Nord et bien moins de décès. En cours de route, nous avons réussi à mettre un terme à une série d'éclosions locales et, plus récemment, à renverser la montée en flèche du nombre d'infections survenues après le temps des fêtes. New Brunswick has enjoyed some notable successes in our journey through the COVID-19 pandemic, in which we can all take great pride. We have seen fewer cases of COVID-19 than many other jurisdictions in North America, and far fewer deaths. Along the way, we have turned back a series of local outbreaks, most recently the surge in infections we saw after the Christmas holidays. We have not waited to be overwhelmed by a crisis. We rode out to confront the virus, slowing its spread with bold, decisive, and innovative measures. Protecting New Brunswickers from further outbreaks will require more of these bold actions, and we are prepared to take them. Vaccines are now available that provide protection against the COVID-19 virus. We have moved as quickly as we could with our campaign rollout, given the uncertain availability of vaccines. But it has not been fast enough. We must get the COVID-19 vaccine into the arms of more New Brunswickers, and we will have to do it quickly. Avec l'arrivée de nouveaux variants de la COVID-19 ayant un degré de transmissibilité plus élevé, il est d'une importance cruciale que nous élargissions la portée de notre campagne d'immunisation. Nous devons nous assurer que tous les citoyens du Nouveau-Brunswick qui sont le plus à risque pour qui sont le plus à risque reçoivent une certaine protection contre le virus. With the arrival of new, more transmissible variants of COVID-19 virus, it is urgent that we broaden the scope of our vaccine campaign. We need to ensure that all New Brunswickers who are most at risk from the virus receive some measure of protection against it. To vaccinate more people, we may have to delay the second dose for some who are at lower risk. This approach carries some unknowns, but it is one that is being increasingly used as an acceptable and manageable option. Our failure to act would, in fact, be the greatest risk to New Brunswickers. And Minister Shephard has spoken about the details of our revised vaccine strategy, and I would like to explain why we are taking these actions and how they will benefit those at greatest risk from COVID-19. We find ourselves in the eye of a perfect storm that could lead to new outbreaks. New variants of COVID-19 that move more easily and spread more readily have been detected in every part of Canada, including New Brunswick. Nous nous retrouvons devant un concours de circonstances parfait qui pourrait causer de nouvelles éclosions. De nouveaux variants de la COVID-19 qui se déplacent plus rapidement et se propagent plus facilement ont été décelés dans toutes les régions du Canada, y compris le Nouveau-Brunswick. In time, these more aggressive strains will become the predominant form of the virus. And at the same time, we are seeing an increasing level of pandemic fatigue, which makes it more challenging to ensure adherence to public health advice and guidelines. We have seen what happens when these new variants strike. Last week's outbreak in Newfoundland led to more than 200 infections in less than a week. Concurrently, we have begun vaccinating our citizens. We knew supplies would be limited at the start, so we've concentrated on vaccinating those at higher risk of either severe disease or exposure, frontline health care and long-term care workers, long-term care residents, First Nations adults, and those over the age of 65. During this phase, we have strived to get 2 doses into everyone who received the vaccine. Nous constatons cependant qu'une seule dose est efficace et l'expérience acquise avec d'autres vaccins nous permet de croire qu'une seule dose peut aider les personnes qui ont besoin de protection pour une période de temps raisonnable. La première dose de vaccin à ARNM, Moderna et Pfizer-BioNTech, offre une protection de plus de 90% 14 jours après la vaccination. Il est recommandé d'administrer une deuxième dose dans les 28 jours qui suivent la première. Certaines administrations canadiennes attendent présentement 42 jours ou plus avant d'administrer la deuxième dose. We are learning that a single dose is effective, and we expect this can help those in need of protection for a period of time based on experience with other vaccines. The first dose from the mRNA vaccines, Moderna and Pfizer and BioNTech, offers more than 90% protection starting 14 days after the vaccine is administered. The recommended practice to administer the second dose within 28 days. Some Canadian jurisdictions are now waiting for 42 days or more. But I should note that some countries are waiting up to 90 days between doses, including the United Kingdom, which has a significant amount of its people now vaccinated. Our goal will be to administer the second dose as soon as we can, but certainly within 90 days. This is keeping with our goal to maximize the number of vulnerable people receiving at least one dose of the vaccine. We will delay the second dose for those who are at lower risk of severe outcomes while giving the two-dose schedule on time for the most vulnerable. By offering some protection to those who may become seriously ill, we will reduce potential hospitalizations and keep our healthcare workers and facilities from being overwhelmed. Nous savons que le virus est particulièrement dangereux pour les personnes de plus de 70 ans. Ces personnes seront prioritaires au cours de la prochaine phase d'immunisation qui débutera en avril. Nous placerons en priorité les plus jeunes adultes qui ont des problèmes de santé complexes pour éviter qu'ils se retrouvent à l'hôpital en raison de complications graves attribuables au virus. We know that the virus presents a danger to those over the age of 70, and they will be a priority group in the next phase, which will begin in April. We will prioritize younger adults with complex medical conditions to help keep them from ending up in the hospital with serious complications from the virus. We will also protect those whose residence or work make them vulnerable, residents and staff of communal settings, additional health professionals with patient contact, police officers and firefighters, home care support workers, those who cross borders for work, and volunteers and designated support persons within the long-term care facilities. These groups may not receive the second dose as quickly, but this approach will provide a high level of protection to a larger number of people. It remains our intention to provide every person with their second dose. And I remain hopeful that by this summer, there will be sufficient vaccines available to meet the need of the overall population. This is not a perfect approach, but action is required. Through this effort, we will be giving more New Brunswickers a chance to fend off this virus, limiting future outbreaks and protecting those in greatest need of protection. Ainsi, nous permettrons à davantage de citoyens du Nouveau-Brunswick de combattre ce virus, limitant du même coup les éclosions futures et protégeant ceux qui en ont le plus besoin. Aujourd'hui, Santé publique annonce qu'il y a 4 nouveaux cas de COVID-19 au Nouveau-Brunswick. Ils sont tous dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a présentement 111 cas actifs de COVID-19 dans la province. 5 personnes sont présentement hospitalisées en raison de la COVID-19, dont une aux soins intensifs. Today, Public Health is reporting 4 new confirmed cases of COVID-19 in New Brunswick. All of these cases are in Zone 4, which is Edmundston, Grand Falls, and St. Quentin. There are now 111 active cases of COVID-19 in our province. 5 individuals are currently in hospital, including one who requires intensive care. Please keep these New Brunswickers and every other person whose life has been touched by this virus in your thoughts and prayers as you go about your day. La diminution du nombre de cas est encourageante, surtout dans la zone 4. Je tiens à remercier les gens de la région de Madawaska pour tous les efforts qu'ils ont déployés et qu'ils continuent de déployer afin de limiter la propagation de la COVID-19. Vos efforts acharnés ont porté fruit. Santé publique a recommandé au cabinet que la zone 4 retourne à la phase d'alerte orange. Le fait que tout le Nouveau-Brunswick se retrouve à nouveau à la phase d'alerte orange constitue une réalisation de taille. Cependant, nous devons continuer à faire tout notre possible pour poursuivre sur cette lancée positive. I want to offer my thanks to the people of the Madawaska region for all they have done and continue to do to limit the spread of COVID-19. Your hard work has paid off. Public Health has recommended to Cabinet that Zone 4 return to the orange alert level. And I'm showing you a slide right now. And this is a slide that depicts Zone 4 since the beginning of the year and the cases. So when you look at the orange line, that orange line represents the number of cases, not including the cases at long-term care facilities. And the blue line factors in all of the cases, including the long-term care facilities. And what you can see is that when the lockdown was implemented, and we had moved to that red phase a few days prior to that, it demonstrates that the public health measures prove to be effective when we follow them. And again, you can see how the cases dropped at the end of that slide. So having all of New Brunswick once again at the orange level is a significant achievement. But we must continue to do all we can to maintain this positive momentum. So please continue to wear a well-made and well-fitting mask when you are out in public. Please maintain 2 meters of physical distance from others you meet. Please stay at home when you don't feel well. Please watch for symptoms of COVID-19 and seek testing when symptoms emerge, no matter how trivial they may seem to be. These actions will and have reduced infections, slow the spread of disease, and save lives. And they will help buy the time we desperately need to get our population vaccinated so that we can keep New Brunswick on this positive track. Thank you so very much.
Thank you everyone for your understanding. Merci tout le monde pour votre compréhension. We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Silas Brown, Global TV.
Thanks. That's a lot of information to digest today. I'm curious, Dr. Shephard, Minister Shephard, you did mention that this plan will be updated and changed as vaccine rollout schedules change. I guess, how much of that are you anticipating going into this? Are you looking at this as potentially really the kind of concrete plan moving through the next at least 2 months here, or are you expecting to see potential major changes coming over the next couple of months that could see this plan adapted and changed?
I think we can say today that we have fairly good confidence that the numbers we've got now are going to be solid for the next couple of months. And the federal government released numbers this morning, and they have now used the word confirmed. And so that helps us a lot in our planning. And as we go forward, the clinics will be planned and prepared. And as you know, we'll be getting into the long-term cares residents first. They are prioritized, and we'll have to utilize Pfizer vaccine for a good bit of that now.
Thank you, Mr. Brown. Thank you, Minister. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour le Dr. Russell ou bien pour la ministre Shephard. Selon qui peut y répondre, j'aimerais savoir exactement combien de personnes vous pensez que vous allez pouvoir vacciner avec cette nouvelle méthode de vaccination, d'utiliser seulement une dose au début. Dans le sens, combien de personnes de plus vous pensez pouvoir vacciner que si vous utilisez la méthode précédente?
Yeah, sure. Do you want to?
Okay. Bonjour, je vais juste commencer la réponse, puis le ministre Shephard va continuer. Avec cette nouvelle plan, ça veut pas dire qu'il y a plus de gens qui vont être vaccinés en total, mais plus rapidement avec le nombre de doses qu'on aurait reçues, avec l'horaire qu'on a à ce moment-ci. Ça va continuer à changer, j'imagine, au fur et à mesure qu'on a d'autres informations, nouvelles vaccins seront approuvés pour notre utilisation, mais à ce moment-ci, c'est pas que un plus nombreux de gens vont être vaccinés, mais les gens qui sont plus vulnérables vont être capables d'être vaccinés un peu plus vite que l'autre façon si on attendait pour donner les deuxièmes doses à chacun. Mais si vous avez besoin exactement le nombre, je crois qu'on pourrait le trouver parce que c'est quelque chose qui est calculé et même Greg MacCallum est ici, peut-être il y a les chiffres aussi.
Oui, Dr. Russell, I think that's, I'm looking for a number and I'm just not 100% sure, so I'm sure Mr. MacCallum has that number with us.
That's not a good start. As has been explained, the aim of extending the amount of the interval between doses gives us the opportunity to immunize more people. And the number I will give you for the April to June period will give you a sense of, first of all, how many doses we can anticipate receiving. And that is essentially almost 500,000 doses over a 3-month period. Now, as you can appreciate, and you've heard the list of priority groups for that period, certainly that is an abundance of vaccine that will be available over that 3-month period. And we do have the assurance of the federal government. So quite frankly, we would anticipate that by early July at the latest, we would have by then immunized half of the population of the province. And to put a finer point on it, at least half of the population of the province by that point in time would have, in large part, received 2 doses or at least 1 dose. This entire rollout of the vaccine nationally has been progressive and it builds exponentially. As we all know, from mid-December until this point in time, it's been limited. And that is purely because of the global demand for this and the market supply capacity. We did experience some delays with Pfizer retooling their facilities to be able to be more productive. We have also experienced some delays with Moderna, which went through growing pains as well. However, to answer the question, in the period where we are starting to see the significant increase in vaccine delivery, we will be able to vaccinate more people sooner, gain the protection of a first dose, and it's a continuum. As it rolls along, we will be administering second doses to the most vulnerable first, of course, but we will be protecting a larger number of people over that course in time. Thank you.
Thank you, MacCallum. Merci, Monsieur Vaudreau. Laura Brown, CTV.
Hi there. A lot of information, but I did actually want to know and clarify if that this suspected variant case has been confirmed or not yet.
Five UK variant cases? Yeah. 5 is correct.
Thank you.
Jacques Poitras, CBC.
Hi, I will add my comment that it's a lot of information. The National Advisory Committee on Immunization has these boxes with the 3 stages showing what they are recommending to the provinces and when, or who should be done when. And I'm just trying to compare quickly with what you've said today. Is there anyone, with a bit more vaccine ahead of schedule coming, is there any deviation from their recommendation that the province is doing? Is any group being moved up earlier? Anyone being moved later because of the 1-dose approach?
I'll let Mr. MacCallum correct me if I'm wrong, but I don't believe so, because I think up until the end of March, we're going to be able to do what we've said we were going to be able to do. So, and then as we go into the second quarter, that's when the numbers are going to get more increased. But if Mr. MacCallum, if you have an update on that, please feel free.
To the specifics of your question, for the most part, as guidance, the National Association Advisory Committee on Immunization's priorities are very much in lockstep with the province of New Brunswick's. The key factor in determining those priority groups, of course, is vulnerability. And not everybody can be at the front of the line. So in deciding and determining what are first among priorities, the one factor that is taken into consideration, first of all, obviously, is vulnerability. And that directly correlates to age groups. We know that the elderly are more vulnerable for a number of reasons. And if there was any decisions that needed to be taken along the way here about who moves slightly to the right in the time continuum, it is those people that are the least vulnerable or the most protected, if you like. We have been very diligent in sticking to those priority groups, and we have been, to this point in time, able to maintain compliance with those recommendations. Thank you.
Thank you, Mr. MacCallum. Mr. Shepherd is coming back to the podium. Mr. Poitras.
This is going to be a little bit more specific, Jacques. So in the April to May category, the categories that have been moved up are individuals 70 plus, individuals with select complex medical conditions, long-term care center volunteers and designated support persons, individuals age 40 plus with 3 or more selected chronic conditions, and truckers, rotational workers, and regular cross-border work commuters. They have been moved up as a result of these extra numbers.
Thank you, Minister. Thank you, Mr. Poitras. Adam Harris, Brunswick News.
Thanks, Bruce. The National Advisory Committee on Immunization has recommended that provinces can accelerate the number of people being vaccinated by delaying a second dose for up to 42 days. That's based on scientific data. Now, I know there are other jurisdictions around the world, and you pointed to them, that are trying up to 90 days, but I'm not aware of any science that says that will work or is recommended. And the Advisory Committee on Immunization has not recommended that. So where is the science backing up today's decision to prolong as long as 90 days?
So I think, Adam, if we had the number of doses that we would like to have sooner rather than later, we wouldn't be having this conversation, obviously. And I think the pressure is on us right now in terms of trying to stay ahead of the variants and protect those most vulnerable. And I think if you go back to my speech that I read twice, it did highlight the fact that those most vulnerable will get their 2 doses within that time frame, with the earlier time frame of 42 days. So again, this is a work in progress, and we're going to continue to use our best evidence and our best information, knowing that there are some uncertainties and there are some unknowns. We don't actually have all the answers, and I also mentioned in my speech that it's not perfect. So again, and things have been changing constantly, and we expect them to continue to change. So this is our best guidance that we can provide at this moment in time, based on all the information that we have, based on gaps in our information, and based on the delivery of the vaccines that we're being told we will get at this point in time.
Thank you, Doctor. Thank you, everyone. Thank you, Mr. Harris. Vicky Hogarth, CHCO.
Thank you, Bruce. My question is either for Dr. Russell, Minister Shephard, or Greg MacCallum. Now that Health Canada has approved extracting 6 doses instead of 5 from each Pfizer vial, how will that affect vaccine rollout in New Brunswick in combination with the new vaccine strategy? Do we have access to the special syringes required to extract 6 doses? How will this affect us?
It's my understanding that the new syringes are arriving in conjunction with the vaccine, so we should be okay there.
Thank you, Ms. Hogarth. Thank you, Minister. Derek Dubé, CHAI-TVA.
Oui, la question est pour la Dr. Russell ou la ministre Shephard, quoi que ce soit. J'aimerais savoir, est-ce que les équipes de hockey junior de la province vont pouvoir jouer dans une bulle ou quoi que ce soit dans un avenir rapproché ou la menace de variants peut faire en sorte de retarder ce retour au jeu avec ces équipes?
We'll see. So that plan is coming forward to public health as we are working on what I call our path to freedom. And so right now, we have to remain with where we are. I'm going to suggest that as we progress, we could possibly see a return to league teams having some competition, practices continuing, in-house scrimmages. I do not see tournaments happening anywhere in the next weeks.
Parfait, merci.
Jean-Philippe Hugues, Radio-Canada.
Oui, bonjour. J'ai une question pour Mme Russell. Donc, puisque la province ne contrôle pas l'approvisionnement en vaccins, tout comme on l'a vu dans les dernières semaines, s'il y avait une pénurie, par exemple, vers le mois de juin, quelles sont les conséquences pour les gens qui auraient reçu une seule dose et qui ne pourraient pas avoir leur deuxième dose avant 90 jours, par exemple?
Alors, l'information que j'ai reçue, c'est que les gens qui sont les plus vulnérables auront leur deuxième dose par les 42 jours. Alors, ceux qui ne le recevront pas, ça veut dire qu'il y a moins risque parce qu'ils ne sont pas dans la catégorie des les plus vulnérables.
Harry Forrestal, CBC.
C'était pas ma question. Vous permettez que je relance? Désolé, c'était pas ma question.
OK, peut-être j'ai mal compris. Je croyais...
Hang on, Harry.
Dr. Russell,
Hang
why
on.
has it taken so long to reach a conclusion? Other jurisdictions reached some weeks ago. Get as many people the first shot and worry about the second shot later. Now we're looking at delaying that second shot by as many as 90 days. Could this have been done any sooner?
I'm going to let Greg MacCallum answer that, but I'm going to come back to Jean-Philippe's question as well.
Thank you for the question, Harry. You're right in that we took our time, and we took our time because of uncertain supply. We did not want to get ourselves in a situation where we could not be assured of being able to administer a second dose. The science was incomplete. It continues to be. However, we took a very strategic approach and held back second doses, and we bided our time in terms of making the penultimate decision about how we would roll out the remainder of the campaign until we had a greater certitude with regard to the supply chain. You say other jurisdictions made the decision before us, and I don't doubt that. I know that to be a fact. That is not our concern, however. Our concern was to do it right the first time, and I believe we have. Thank you.
Jean-Philippe,
Oui.
tu répétais ta question, s'il vous plaît.
Oui, je vous remercie. Désolé pour le contretemps, là. Ma question, c'est quelles sont les conséquences sur quelqu'un qui n'aurait pas sa deuxième dose après 90 jours, par exemple? Je sais que la science est incomplète, mais est-ce que, par exemple, l'immunité pourrait disparaître après 90 jours? Qu'est-ce qu'on fait là-dessus?
Ah, OK. J'ai mal compris la question. Je croyais que c'était la protection pour les plus vulnérables. Alors, juste pour dire encore, pour répéter, que les gens qui sont dans la catégorie les priorités les plus vulnérables, ils vont recevoir leur deuxième dose par 42 jours. Et les autres, c'est ça, on veut qu'ils le reçoivent par la 40 jours dans les autres priorités, groupes de priorité. Si ça arrive qu'il y a quelqu'un qui ne va pas le recevoir après la 90 jours, c'est pas exactement compris à ce moment-ci ce qui va arriver, mais moi, j'avais l'information que ce serait encore plus... il pourrait le recevoir après les 90 jours. Je m'excuse, il n'y aura pas besoin de recommencer la série. Alors ça, c'est l'information que j'ai maintenant, qu'on ne peut pas dire exactement comment l'efficace va être, sauf que c'est réservé, cette situation va être réservée pour attendre la 90 jours avec les gens qui sont moins vulnérables. Alors, les conséquences seraient moins au niveau de la protection, mais non, on ne sait pas exactement combien longtemps la première dose va durer au niveau de la protection, mais on est assuré que même s'il y a un délai, ils ne vont pas être besoin de recommencer la série.
Merci. Savannah Ott, Telegraph Journal.
Hi, my question is for Dr. Russell. We know the spike in January was largely related to travel and gatherings, as you said, over the Christmas break. But the same things also tend to happen over March break when students are off. So I'm wondering, is public health doing anything differently this time to prevent or prepare, I guess, in case we see a similar spike after March break?
Well, first and foremost, the risks are elevated now because the risks of the variants are increased. So we know that jurisdictions all over the world and the rest of Canada, and including New Brunswick, have the variants, have cases of the variants, and we know that exponential growth in cases can happen quite quickly if there are outbreaks caused by the variants. So in terms of the different approach, I mean, obviously before the holiday season around Christmas, we were all, I think, in the yellow phase of recovery. So that carries with it some risks, even separate from the variants. But I think as of right now, we're hoping to be in a period of stabilization. We know the risks are still going to be there because we can't get the risks to zero. But in terms of minimizing all of the risks associated with March break, I mean, obviously some provinces have decided to delay the March break. In our case, we're just discouraging interzonal travel. We're, travel between zones at this point. We're encouraging people to stay at home. We're trying to highlight the risks so that people understand that if they do travel, they will have to come back, self-isolate for 14 days. And again, the risks are not going to be zero because we know that household members can become infected if you're not self-isolating properly within the same household. So again, all the public health measures that we have in place right now are to make sure that people have the information and have the things that they need to protect themselves. And at this point, that is our approach. And we've been trying to give that message to the public around staying put for March break.
Thank you, Doctor. Thank you, Ms. Ott. Mia Urquhart, CBC.
Thanks, Bob. My question is for Minister Shephard. With a growing number of families coming forward to talk about the impact of strict no visiting rules for vulnerable and dying family members in hospital, will the government consider these requests on a case-by-case basis rather than applying a blanket rule? And is there a way to allow one family member to visit a loved one in hospital using PPE or priority vaccination?
Thank you for the question. And there's no doubt that this has been a heartbreaking time for many families. And I don't think any family has been spared this difficulty with having loved ones in hospital and in long-term care residence where visitation is just so limited. What I can say is this, that we're working with the RHAs to certainly try to find a path forward that can be workable for everyone. I'm sure that it can be appreciated that protecting our most vulnerable is what this is all about. And so it's not easy. And our hearts go out to everyone who have been put in this situation. What I can offer is that even under orange, and at times even in red, we do have exemptions for compassionate visits. And I know it's hard, and I know that when someone is terminal, family wants to be with them. And so normally we can have someone who's palliative can certainly have up to 10 designated individuals, and those individuals may visit one at a time. And I also know that, there are some restrictions around palliative when it comes to at what stage a patient is at. But every effort is being made to get families certainly in at end of life. And we will continue to try to progress that, and hopefully we'll have some more news next week coming from our discussions with the RHAs.
Thank you. Andrew Waugh, Brunswick News.
Yeah, I'd like somebody to walk me through how the province is tracking who's been vaccinated? Do you have like a central database? And someone, if you can explain to me how that information can be shared or can't be shared because of privacy rules?
I can tell you that right now both RHAs are tracking this now, and I think that I'm not sure how much extra data you need. The vaccination dashboards are updated on a weekly basis, and it is, we have our priority groups, and they're certainly coming through the clinics, and I'm not sure what more information you would need publicly.
Marie Sutherland, CBC.
Hi, my question's for Dr. Russell or Minister Shephard. Just wondering, can you tell us when grocery store workers and other essential workers will be considered for the vaccine under this revised rollout plan?
So we still have that list of priority. And of course, as Dr. Russell has explained with the vaccine rollout and Mr. MacCallum as well, the idea is to get everybody vaccinated as soon as possible, starting with the most vulnerable first. And so if you are healthy, if you follow public health guidelines, as in every workplace must have an operational plan, I think you can expect that it will be summer before you get vaccinated. And as I've explained earlier, we've moved some groups up in the list, and they're prioritized by certainly age and with regards to their medical conditions and long-term care center volunteers. And we're going to proceed in this manner. I know that everybody wants to be vaccinated, and I'm very pleased about that. I've just asked that people be patient and follow public health guidelines, because that is a proper way to protect yourself.
Thank you. Tom Bateman, Brunswick News.
Oh, good afternoon. Thank you all for your time. In late November, we heard from the Premier, from the Education Minister about, approaching the finish line of the pandemic, and that we should hold back because we're getting, to about 100 days before we're seeing the back end of all of this. Now we better understand the risk variants pose to the province. You noted the increasing levels of pandemic fatigue in the province, involving deployment of vaccines. I just wonder if the Minister or Dr. Russell could circle back and maybe address, when we should look forward to seeing the end of the virus and feeling more optimistic about our circumstance here at New Brunswick. Is the light at the end of the tunnel perhaps a little farther away than it seemed in November or December? Thank you.
I don't think so. We've always said that we wanted to get our province to 75 or 80% vaccinated by September. And I think right now that's that's still the realistic goal. And I think if we get there, we can look forward to perhaps having that normalcy or a new normal. What I can say though is that while this process is going on, that is the light at the end of the tunnel. And we still need everyone to be collaborative and follow public health guidelines, wearing this mask, washing your hands, staying 6 feet apart. These methods are working. And we can see just over these last few weeks how our numbers have come back down. And we're not under 100 yet, but we are consistently having our numbers come down in this province. And that's because of the measures we've taken and put in place. And so that's very encouraging that we have the ability to have a lot of say in how this illness takes over our lives. And so if we continue doing what we're doing, the light at the end of the tunnel is actually getting brighter.
Yeah, I support what Minister Shephard has just said. It is very true. The finish line has changed in the sense that we have other complications and uncertainties that have come into the picture and come into play. But at the end of the day, and you might recall what Dr. Dow said last week when he presented, that even with the variants in place, becoming the dominant strain, that the public health measures that we have in place right now are working and will continue to work, presumably. And the issue around, some of the protective factors that we have in place around our borders, in terms of 14-day self-isolation for people coming into the province, that has worked very well and will continue to work very well at this time. But again, it has been an evolution and it will continue to evolve. And in fact, when I leave here, I'll be on the Special Advisory Committee call, which I participate in 3 times a week with my colleagues across the country. And we are actually looking at revising whatever things we do need to revise around the variants. So I think that people can feel deflated and people can feel pandemic fatigue because of all those changes and thinking, well, when are we going to get there? When do we get there? Just like children in the back seat of the car, which we've all done. And are we there yet? Are we there yet? When are we going to get there? It is challenging, there's no question, and it does take energy, and it does take time, and it does take processing in terms of how we cope with this collectively. And when we say we're getting ahead of the virus, we're stamping out each time we have an outbreak, that is a success in itself, as Minister Shephard says, and we have to be very, very proud of that. So I think hanging on to the hope for the future in terms of getting as many people vaccinated as possible, protecting our most vulnerable while having to deal with the variants. Again, the public health measures that are in place right now will continue to work and continue to protect us. We do have a ways to go, but we're going to get there.
Thank you, Minister. Thank you, Dr. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell or Minister Shephard, whichever one you can speak to this. I'm hearing concerns about the size of Zone 3, with the mayor of the Upper Miramichi rural community saying his municipality falling under Zone 3 unfairly punishes his residents for keeping cases low and following the rules, and it causes problems for residents traveling between communities for work because they're required to do so. He says his community and some nearby are better aligned with Zone 7. So can you share a bit of information on how the health zone boundaries were initially set and what factors are considered when you're deciding whether to change them?
Thank you for the question. There are very, very few changes that have been made to the zones in New Brunswick. First of all, it's really important that we share the responsibility of protecting each other with regards to COVID by following public health measures. And when zones are flipped from one to another, believe me, I've had some areas that we have compromised because of not really communities of interest, but because it did make sense geographically to make a change. To find that the people who changed actually went into a darker color phase sooner than anybody else because of that change, and that is just the way it is. But with regards to traveling for work, there is certainly there's no prohibition with traveling for work from one zone to the other. We ask that you continue to follow those public health measures and follow the guidelines. Thank you.
Merci tout le monde pour votre patience. Voilà la fin de notre mise à jour. Merci beaucoup. Again, thank you everyone for your patience today. That concludes today's update. Thank you.